Hello everyone, welcome and namaste. First of all, I'm so sorry that it has been a while now that I haven't uploaded any video. So today I am here with a most waited video about how to write a supporting information. I This video is pretty long, like half an hour, and it's long because I have tried to cover the important points that you have to consider while writing a supporting information. To write a beautiful supporting information, I will say, because it's completely based on my experience and my knowledge. So yes, it's gonna be quite long, but I will highly recommend you all to go through it, not to skip, because there are points that you must or should have to look before even thinking of writing a supporting information. So yes, I hope this video will be of a little help or a lot of help. So without further ado, let's get started. These pop-ups from my screen. Okay, so before you apply for any of post, or before you start writing supporting information, there are two things that you have to watch out for, and that you can find in this section here about this job. So you have to make sure that you read these particular points that I'm going to explain now, so that you can make a beautifully composed supporting information. First, look out for which hospital, obviously which hospital you are gonna work, what kind of contract they're offering, either it's permanent, full-time, or what kind of salary and specialty, under which specialty you're gonna work. After you open this after you open this post page, you directly go down to somewhere here and do yourself a favor of not wasting time in filling out application that's not going to provide you a sponsorship, because if you want to come and work in United Kingdom, you obviously need some sponsorship. So it clearly says that job seeker who require sponsorship are welcome to apply for this post and will be considered alongside with other applicants. So you have just done yourself a favor, knowing that if you clear the interview, they are going to provide you the sponsorship. So after reading that, just start reading from beginning. Basically, do not just indulge, get into it, try to know what are the what is the hospital, how many patients that they serve, blah blah blah, but just get the overview idea of what kind of person, what kind of nurse they want to hire. So just read out this. In this three stanza, they have basically said what is this hospital, in which level they serve, how for whom they provide services, and how they are how they provide world-class teaching and research, and their objective, blah blah blah. They are just saying who they are. Down here you can read job overview, where this is once you clear the interview and you're selected, in which level you're gonna work. You're gonna work as a band 5, you're gonna work in a critical care, where you will be dealing with patient who had who had hepatic surgery, because they are enhanced recovery liver transplant hospital. So the cases that you are going to see will be medical surgical patient with mainly liver-ish kind of thing. Along that side, you'll also, since it's an intensive care unit, you'll also see infectious disease, some kind of cardiac case, and all mixture of all of it, but mostly a hepatic kind of cases that you are gonna see. So the point to take out from this is like, if you had experience of working in some liver hospital or liver ward or anything like that, you can use that point as one of your strongest point. Like, look, I have worked here for a certain time, so I think I stand out on this. So that can be one thing that you can take from here. So further, they says like, what are gonna they provide you, sorry, let me paraphrase that, what they are gonna provide you. So they are gonna provide you with a course once you have completed the basic requirement. So they are gonna provide you with a course that is equivalent to 6 credit, so it's kind of post graduation course, but in order to do that, you have to successfully complete your foundation program or something like that. So this can be another point that you can take from here, which I have taken in my supporting information, which I'll explain to you in later videos. Going down here, you can see detailed job description and main responsibilities. So this is the thing that you have to really be reading through, because these are the point that you are gonna take out from here and make a comprehensive paragraph out of it. Yeah, so just read through this. Your clinical responsibility will be looking after the patient who are in need of like high standard evidence-based care. And in second one, they are saying like, we are looking for a nurse who can follow trust policies and procedure. Third, they are saying we are looking for a nurse who has a clear communication skill. Furthermore, they are saying that they are looking for a nurse who has a good writing skill, like appropriate documentation. They are also looking, they are saying that they are looking for a nurse who is good at early discharge planning and like referrals, arranging all those community services and everything like that. Another thing is like, they want someone who is good at drug administration and safely handling of drugs like controlled drugs and stuff like that. And they also says that they are looking for someone who can train their junior staff, unqualified staff, or like anyone, like they should have the ability to provide training, guide them in intensive care unit basically. And they are also saying that they want someone who has a good communication skills and who can work in a multidisciplinary team, because obviously in ICU it's not like just doctor gonna come and tell you like you have to do this and you do that. Basically it's not like that, it doesn't work like that. So they are looking for someone who has capacity to listen from everyone and also raise the concern and talk to different specialty people to provide a comprehensive care. And down below they are saying that they also want someone who knows the idea, who can like participate in audit and benchmark the process and implement and take the action plan kind of thing like that. And they are also looking for someone who can coordinate the department, and they are looking for someone who can safely work in the unit, and they are also looking for someone who can work with senior team, bed manager, and all those kind of multidisciplinary team people. Yeah, so going through all of this, I think you now have a rough idea of what kind of person, what kind of nurse they are looking for. Yeah, so just to summarize, I can say that they are looking for someone who can work in a multidisciplinary team with a good communication skill, who can tutor or who can help guide the new trainee staff, student, or anyone who is new to the ward. They are looking for someone who has a good skill of assessment, implementation, evaluation, and stuff like that. And they are also looking for someone who can give medication and safely handle the medication, who has experience of working with senior team member to do like bed management, nursing, rotation, shift, so they're also looking for basically managerial aspect. They are looking for a lot of things. However, you don't have to have all this skill. You can just take some point from this like given stanza and write in your application. Yeah, and that's what I have done. So after reading this, another thing that you have to look is for job description, which I have already opened in another tab here. So once you open the job description, it gives you a detailed idea of what exactly they are looking for. So the thing that we read previously is a brief kind of thing that they are looking for, the brief summary, but this is a complete brief, complete detailed description. You have to read this as well. Just go through this. While you go further down, it says like what are their values, and it's very necessary because while you are attending an interview, they will ask you a question like, okay, why do you want to work with us, kind of thing, where you can bring this like, my values closely align with the trust values for so and so reason. So when you go down here, this is like you should have certain clinical responsibility, in which they are saying like, if you are applying for the ICU post, you should be able to look after level 2 and level 3 patient. Level 2 and level 3 basically means like patient with tubed, like with endotracheal tube requiring multi-organ support. Let me just say that again. Level 2 are the patient that are in SDU, that basically patient who are in SDU with monitoring attached, with few things like requiring nasal oxygen or stuff like that. And level 3 are people who had intratracheal tube on that can be a tracheal tube as well, a tube on, and requiring multi-organ or single organ support. So they are looking for someone who had worked in such kind of setting, and then they says like they are looking for people having intratracheal tube. They are looking for staff who can manage intratracheal tube, artificial ventilation, inotropic support, paralyzing agent, who is familiar with paralyzing agent, sedation, and all those things, who can hand over using an S bar, and it goes on, like so many things are there. So down, when you scroll further down in the management role, they are looking for someone who can body in the, what does body means again is like, you will have a patient, the other nurse will have patient, but the other nurse will be a new starter who might just need need someone to look after, or need someone whom she can come with problem, with concern, and you can basically be her body. So you should be able to act like that, or you should be able to assist new staff, liaise with other hospital, all this kind of thing. You just have a read. And in the leadership quality, they are looking for someone whom you can co-mentor. It basically means like whom you can teach or help. In educational responsibility, they are looking for someone who is trying or who is willing to develop themselves by doing a lot of different courses that the hospital has provided, kind of thing like that. And you can further read through all of this. I'm not going through all of the description because I don't want the video to be too long and too boring. So in summary, you just have to read all of this at least once and try to like jot down certain points somewhere roughly. Just write some in your note or anywhere, just write it down, so that while you are composing the personal specification column, you will have points to write. So let me go to my application that I have submitted. So let me go to my application that I have submitted. Yeah, so view application. So going down to supporting information. So this is what I had written, and I was called for an interview. So I'll just go through it, and you just try to relate what we have discussed, or what we have highlight the points that we have highlighted earlier, and how I have just paraphrased it and try to express myself. So in the first stanza, I have said like who I am, and just a brief description of who I am, why I think my values align with the trust values, and what I am willing to provide to the team members. So I have written like, I'm writing to express my interest in band 5 position in intensive care at blah 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 hospital with my extensive, I can't move it, but with my extensive experience and dedication to high quality care. I believe I can significantly contribute to the team. Additionally, my values and strength align closely with the core principle of trust and help me guide and structure my daily practice and interaction with patient, families and colleagues. I'm committed to providing the best care possible, ensuring fairness and giving equal opportunity to all patients regardless of their background. Working as a part of team is a crucial in intensive care unit, and I value the collaborative approach and clear communication that enhance patient outcome and foster a supportive work environment. So if you read this and this, I think you had an idea. Like, I tried to summarize all the job description, like not all, but the thing that I can say that I can provide them. So I just try to summarize it in one sentence. Going down, I have explained why I think I'm an ideal candidate by saying one of my key strengths is flexibility. I can adapt to varying work schedule, including day and night shift, which is essential in dynamic environment of ICU. I can act promptly on concern, ensure patient safety and well-being are prioritized. Effective communication is another strength, and I constantly share information appropriately, adhering to a standard set by the trust policies and protocol. This ensures that all team members are informed and can provide coordinated care. The ICU often present unpredictable workload, including medical emergencies and highly it's not charged. See, like, you can have mistakes in your supporting information. I was trying to write highly challenged situation, but like I ended up writing charged. So it should not be a perfect supporting information. It just should be clear, and the readers should know like what qualities you have and what you are willing to offer to the team. Yeah, so you can have a mistake. Highly challenge situation. My ability to remain calm under pressure and manage this challenge effectively has been honed through these years of experience. Furthermore, as being an ICU nurse, I am quick at assessing situation, implementing necessary intervention, and providing high quality care even in most demanding circumstances. So basically here I have dumped all my strength. So I have said that I'm flexible, I can do this, that, shift. I have worked in ICU is a dynamic changing situation. I have worked there. While working in a changing environment, prioritizing the work is very key, so I can prioritize effectively and work, and also make sure that the patient safety is not compromised. And while working in a changing situation, you should have a strong communication skill. So I have a strong communication skill, and while communicating, I'll make sure that I follow the trust policies and protocol, because follows policy and protocol, so that communication will be informed, and the coordinated care could be provided. And then all these things, like, and also working in a ever-changing dynamic environment, it can be quite stressful at some times. So I have ability to remain calm under stressful scenario, and then I'm very quick at, and even though the environment is very stressful, I'm quick at assessing situation, assessing situation in the sense change in patient condition, and implementing and evaluating the plan and provide high quality care. So I have dumped all my strength in this paragraph. So in third paragraph, I have said that I am qualified in handling complex drugs therapy. I have done renal replacement therapy training, respiratory support training. So here I have said, like, what I have been doing in intensive care. Of course, like, if you are working anywhere in intensive care, you will be looking after all this kind of patient, and you will be giving all the complex drugs. So you can bring this onto your supporting information. And here I have also said that while providing care, like, my approach here, I have said, like, my approach is always evidence-based, because here in countries like UK, US, they focused on providing care which is evidence-based, not practice-based. So I have said, like, I have provided I have approach of providing evidence-based care, all those kind of thing that I have said in this paragraph. And on the following paragraph here, I have said that if you remember reading the job description, they have said that they want someone who can teach junior staff, or who can be buddy to someone. So here I have said, like, I have that skill, and I not only prefer to teach, but also I'm keen at learning. So, and here, if you remember, there was a section where they said they are gonna provide you with training. So I have said, like, I have already completed national critical care competencies. So based on the experience that I have in ICU and the course that I have completed, I think I will be an ideal candidate for this post. So this will give them a idea that I'm very keen at learning different things and different new things, basically. And here I have said detailing with morbidity and mortality, dealing with morbidity and mortality in critical care, critically ill patient, a challenging aspect of ICU. So here I have basically focused on saying, if you remember, focused on saying that look, I just don't provide care to the patient. I also am concerned about what happening to their family member, because ICU can be challenging. ICU environment can be challenging. Family member could be in distress. So I am good at talking with relatives and handling difficult situation, either with relatives or that can be with a team member, multidisciplinary team member. But I'm good at it. So that's what I have written here. And in summary, I have said that, look, I have highlighted that, look, my values closely align with the value. I'm so sorry. So let me just quickly cancel this. I don't know why this is not. Anyway, never mind. Oops, sorry. So just ignore this side. I couldn't do that. So here I'm saying, like, in summary, my values closely align with trust values. I'm flexible. I can do any shift. And then I am very committed on providing high quality care, and I am looking forward to I'm looking forward to possibly contribute to your STEAM team and furthering my professional development in your renowned institution. And have so basically, on the last paragraph, I have said I was quite distracted with the page that opened inside. So basically, on the last paragraph, I just said, like, I just paraphrased the first paragraph. Basically, I have said, like, look, your trust values is this, and my values align with your trust values as well. On top of that, I'm also committed on providing high quality care, which is evidence based, which you are looking for, and based on the experience, everything. I think I am a person whom you might want to consider calling for an interview, and I can explain, like, we can